this video, I will demonstrating you a very important procedure which is used for emergency and critical care patients and also used in various surgical procedures. And the topic name is ET tube or endotracheal tube, जिसको हम श्वास नली के नाम से भी जानते हैं. In this video, we discuss definition of ET tube, purposes, uses, and in the last, we discuss parts and functions of each part of ET tube. So, let's start with the basic. What is the definition of endotracheal tube? Endotracheal tube is a medical device which is inserted into the trachea or windpipe to patent the airway and provide breathing support to the patient. Means एंडोट्रैकियल ट्यूब एक ऐसा डिवाइस है जिसको हम इंसर्ट करते हैं, डालते हैं ट्रैकिया में और विंड पाइप में, ताकि हम पेशेंट्स को ब्रीदिंग सपोर्ट प्रोवाइड कर सके जो स्वयं सांस लेने में असमर्थ हैं. उन पेशेंट्स में इन ईटी ट्यूब को हम यूज करते हैं. आफ्टर दैट वी डिस्कस द पर्पस ऑफ एंडोट्रैकियल ट्यूब. सो फर्स्ट वन इज टू सिक्योर द एयरवे. मीन्स एयरवे को लेकर यहाँ पर अपना मतलब है ट्रैकिया. मीन्स हमें ट्रैकिया को सुरक्षित रखना है. कोई भी अवैध चीजें जिससे ट्रैकिया ब्लॉक या फिर ऑब्स्ट्रक्ट हो सकता है, इन सब चीजों से हमें प्रिवेंट रखना है ट्रैकिया को, जो कि एयरवे को पेटेंट बनाने में हेल्पफुल होती है ये एंडोट्रैकियल ट्यूब. एंड द सेकंड वन इज टू प्रोवाइड मैकेनिकल वेंटिलेशन. मीन्स मैकेनिकल वेंटिलेशन इज एन मशीन or device which is connected to the endotracheal tube to provide artificial airway and provide breathing support to the patient which is not able to breathing own self. After that, the third one is to prevent from aspiration, to prevent any food material. Or what is the use of endotracheal tube? There are various uses of endotracheal tube in clinical settings. We discuss here one by one. First, in emergency cases, example in cardiac arrest patient. Second, in severe respiratory distress patient. Third one is in respiratory failure patient. We use endotracheal tubes. And second one is in surgical procedures. Endotracheal tube is generally used in various surgical procedures because we administer here a general anesthesia to the patient. And the third one is in critical care patients, example in intensive care units. Now, this is an endotracheal tube. There are two ends in endotracheal tube. This is proximal end which is connected to the mechanical ventilator, and this is distal end which inserted into the trachea. So we start from distal end. So you see here an angled cut opening which is called as bevel, which is used to prevent surrounding tissue damage. You see here small opening which is called as Murphy's eyes, which is used for when bevel or main opening is obstructed to still maintain the airway. And third one is cuff, which is inflated by the help of 10 cc syringe and instill air into this syringe and fit into the spring-loaded one-way valve, which allow unidirectional flow and prevent backflow. This is pilot balloon, which indicate the pressure of the cuff. Just like that, we instill air into the 10 cc syringe and fit into the spring-loaded one-way valve, and you see here the inflation of the valve. Just like that, cuff is inflated, and the function of this valve is to prevent backflow of air, and the function of this cuff is to secure the endotracheal tube in trachea. If the pressure of pilot balloon is loosened, then also the pressure of the cuff is reduced, which allow aspiration and leakage here. And this is PVC tubing. You see here a thin visible blue marking which is called as radio opaque marker or radio opaque line, which indicate the better placement of endotracheal tube and which is seen in the X-ray. And this is a thin tubing which is connected to the cuff. Okay, and at the distal end you see here a adapter of 14 to 15 mm internal diameter, which is connected to the mechanical ventilator. Here two black markings which indicate vocal cord guide, which indicate better placement and placement of endotracheal tube at the level of vocal cord. And the size of this endotracheal tube you see here 7 mm internal diameter. The size of this endotracheal tube is 7 mm and in some patients 8 mm and 9 mm endotracheal tube is also used. In children's also different types of endotracheal tube is used. And we discussed types of endotracheal tube: cuffed endotracheal tube or uncuffed endotracheal tube. Uncuffed endotracheal tube is generally used in children's because of anatomical airway different. ठीक है. सो आज की इस वीडियो में हमने समझा एंडोट्रैकियल ट्यूब होती क्या है, इसके यूजेस क्या होते हैं, पर्पस क्या होते हैं, इनके पार्ट्स और फंक्शंस के बारे में हमने इस वीडियो में डिस्कस किया. नेक्स्ट वीडियो में हम इनके आर्टिकल्स के बारे में जानेंगे. एंडोट्रैकियल ट्यूब्स के अलावा कौन कौन से आर्टिकल्स की हमें जरूरत पड़ेगी और प्रॉपर प्रोसीजर को हम डिस्कस करेंगे, किस तरीके से एंडोट्रैकियल इंट्यूबेशन किया जाता है. मेरी वीडियो अच्छी लगी तो आप मेरी वीडियो को लाइक एंड शेयर कर सकते हैं. अगर आपको कोई भी डाउट आता है वीडियो से रिलेटेड तो आप उसको कमेंट बॉक्स में भी लिख सकते हैं. मैं उस कमेंट को जल्दी से जल्दी सॉल्व करने की कोशिश करूंगी. ज्यादा जानकारी के लिए आप मेरे चैनल को सब्सक्राइब भी कर सकते हैं. थैंक यू सो मच.